My name is Dr. Rana Awdish. I am a pulmonary and critical care physician at Henry Ford Hospital in Detroit. I run our pulmonary hypertension program, and I'm medical director of care experience for the health system. So at the very end of my fellowship training in pulmonary and critical care medicine, I got critically ill myself. I was 7 months pregnant, and a tumor that I didn't know I had in my liver ruptured, and it caused me to lose my entire blood volume into my abdomen. I went into multi-system organ failure and lost the pregnancy and ended up hospitalized in my own ICU 4 months. That experience really was a re-education in the patient experience. I knew that what I survived, medicine helped me to survive, and there were still things that were hard for medicine to do, like sit with suffering that it couldn't fix or attend to grief. And I knew that when I went back to be a physician, I would have to train to communicate different. So there were many things that I heard my care team say when I was critically ill that did not feel compassionate or healing. When I was in the operating room, I heard them say, "We're losing her, she's circling the drain." That was very frightening for me as a patient. My rounding team, when I was in the surgical ICU, said, "She's been trying to die." I knew I was not trying to die, and I felt like by describing me that way, they were saying we were on opposite teams. They were on one side and I was on the other side. And so I took it as my mission when I went back to healthcare, when I was healthy enough to be a doctor again, to practice compassionate communication and to teach it to the trainees as well. I wrote my first book called In Shock, My Journey from Death to Recovery and the Redemptive Power of Hope, right after I got very sick. And it was really about the acute critical care experience. My new book, Aftershock, is about the long tail of recovery, all of the emotional and really spiritual and grief and family aspects to healing that go on much later after the acute illness has passed.